Welcome back. Today we're diving into a fascinating little piece of medical detective work. A patient has hearing loss, but here's the mystery. Is it a simple blockage, or is it a more complex nerve issue? Let's find out how a simple, centuries-old tool can give doctors the answer in just a few seconds. Okay, so picture this. A patient walks in and they've got hearing loss in one ear. The big question, the really big question, is what's causing it? Is it something straightforward like a blockage, or is it a more complicated problem with the nerves of the inner ear? Getting this right is absolutely crucial, and you need an answer fast. So how do you figure it out?
Here's our game plan for cracking this case. First, we'll look at the puzzle itself. Then, we'll meet our surprisingly simple diagnostic tool. After that, we're going to break down the two key tests. They're called the Weber and the Rinne tests. And finally, we'll put all the clues together to get our diagnosis.
All right, let's dive in. First up, we've got to understand that hearing loss isn't just one single thing. It's really just a symptom that can point to some very different problems underneath.
The two main culprits here are conductive and sensory neural hearing loss. Now think of conductive loss like a roadblock. Sound waves are literally being physically blocked from getting to the inner ear. Think earwax or fluid. But sensory neural loss, that's a totally different beast. It's a problem with the wiring, so to speak, the delicate snail-shaped inner ear, or the actual nerve that zaps signals to the brain. And that is the core distinction these tests are designed to figure out.
So how do we solve this puzzle without some big, complicated, expensive machine? Well, enter the hero of our story, the humble yet elegant tuning fork. Seriously, this thing is an inexpensive and incredibly valuable clinical tool.
The whole secret, the magic behind how this works, comes down to the two different ways we hear. First, there's air conduction. That's the normal path, right? Sound travels through the air in your ear canal. But then there's bone conduction. And this is so cool. It bypasses all that outer and middle ear stuff and sends vibrations directly to the inner ear, right through the skull. By comparing these two pathways, we can pinpoint exactly where the problem is.
And this is it. This is the specific tool for the job. But listen, not just any old tuning fork will do. The exact frequency it vibrates at, well, that is the key to getting a result you can actually trust.
And that magic number is 512 Hertz. Now, this isn't some random number they just pulled out of a hat. It is the absolute Goldilocks frequency for this job, and there are some really specific reasons why it's the go-to choice.
So why 512 Hertz? Well, if you go with a lower frequency, like 128 Hertz, you get this buzzing feeling, a vibration that patients can easily mistake for sound. Not good. And if you go higher, the sound just dies out way too fast to be useful. But 512 Hertz? Oh, it's just right. The tone lasts long enough for testing, it produces a pure sound without a bunch of confusing overtones, and it avoids that weird vibration sensation. Okay, so we've got our tool. It's time to gather our first piece of evidence. And this starts with something called the Weber test.
The Weber test is just beautiful in its simplicity. Its only job is to figure out if the sound is heard in the middle of the head or if it lateralizes, which is just a fancy word that means it seems louder in either the left or the right ear.
So here's how it's done. The doctor strikes the tuning fork, not on a hard surface because that creates confusing extra sounds, but on their elbow or the heel of their hand. Then, they place the base firmly on the patient's forehead or the bridge of their nose and simply ask, "Where do you hear the sound?" Now let's break down the results. If the sound is right in the center, that means hearing is pretty much the same in both ears. If it's heard in the better ear, it points to a nerve issue in the worse ear. But here's the fascinating, kind of weird part. With a conductive block, the sound is actually heard louder in the poorer ear. That blockage basically acts like an earplug, insulating the inner ear from all the ambient noise, which makes the bone-conducted sound seem way louder, a crucial clue. But one clue is never enough to solve the whole case. We need a second, complementary test, and that is the Rinne test.
So if the Weber test tells us where the sound is heard, the Rinne test tells us how it's heard. It's a direct head-to-head comparison between air conduction and bone conduction for each ear individually.
The procedure is a simple two-step process. First, the vibrating fork is held just outside the ear canal. That's testing air conduction. Then, immediately, the base is pressed against the mastoid bone. That's that hard bump you can feel right behind your earlobe to test bone conduction. The patient is then asked a really simple question. Was it louder in front of the ear or behind it?
The results are given these simple names. If air conduction is louder, that's a Rinne positive result, and that's what we expect in a normal ear.
But if bone conduction is louder, it's called a Rinne negative result, and that points to a problem.
So, what do these results really tell us? Well, a positive result, where air conduction is better, is considered normal. It can also show up in sensory neural hearing loss because while both pathways are weaker, air conduction is still naturally a little bit better. But a negative result, where bone conduction is louder, that's the smoking gun. It's a clear signal that sound is bypassing a blockage, which strongly indicates a conductive hearing loss.
Okay, we've got our clues from the Weber test and the Rinne test. Now it's time to put on our detective hat, combine the evidence, and finally crack this case. And this is where the magic happens. By cross-referencing the results of both tests, we can diagnose the issue. For example, just look at that second row. If the Weber test points to the left ear and the Rinne test is negative in that same ear, we have our answer, a conductive loss on the left. Each combination of results points to a different specific conclusion, revealing a really detailed picture that neither test could ever provide on its own. But of course, every good mystery has a plot twist. And this one is called the false Rinne negative. So get this, in a case of really severe sensory neural loss in one ear, the bone conduction test can be so loud that the vibration travels right through the skull and is actually picked up by the good ear. The patient thinks they're hearing it in the bad ear, but they're not, and it gives a totally misleading result. This is exactly why you have to use the Weber test first. A contradictory Weber result is your big clue that this might be happening. So let's land on the crucial takeaways. These tests are an incredibly simple, quick, and inexpensive way to get early diagnostic information to figure out the type of hearing loss. But you have to remember, Weber and Rinne are a team. They must be used together to get an accurate picture. And just as importantly, while they provide vital clues, they aren't the end of the story. This is a brilliant screening tool, but it is not a substitute for a full audiological assessment. And that brings us to a final thought. The tuning fork is a 19th century invention, yet it remains an essential diagnostic tool today. It really makes you wonder, in our world of high-tech scans and digital diagnostics, what other simple, elegant tools from the past are still proving themselves to be absolutely indispensable? Thanks for joining us.